All right, welcome to our next episode. Today we are going to do part one of pathology for amphibians. I really like amphibians, toads, and frogs. I find them extremely cute. These two pictures are some of my favorites. They're just very ridiculous and adorable creatures, and I love them, and hopefully you will too after today. Before we get started, I just wanted to give a shout out to a fantastic mentor and a great person who taught me most of what I know about amphibians and frogs, and that's Dr. Richard Montali. Here he is with his two pugs, Sassa and Frass, that were the loves of his life. So he's just a great dude, taught me everything I know about amphibians. And so now I'm going to pass that knowledge along to you in his honor today. So when we're talking about amphibians, the word amphibian contains amphi, which means literally double or two. So these animals have a double life. And what that means is they start life as larvae that are basically fish with gills. They undergo a metamorphosis. They grow legs, their gills regress, they sprout lungs, and they become adults that live on land. So that's where this name comes from, amphibian, this double life, half in the water, half on land. Because of their anatomy and because of their developmental progression here, they are exquisitely sensitive to insults in their environment. And that's really a problem right now, not just with climate change, but also with pollution. A lot of different environmental pollutants affect these guys in extreme ways because they're so sensitive. So amphibians are a really important sentinel species and give us kind of a clue to how our environmental health is doing. Amphibians in research, just going to talk a little bit about that. So these are the most common species. Xenopus is really probably about 90% or more of amphibians in research. It's very commonly used. The Xenopus is totally aquatic, so it spends all of its time in the water. They have this really big, fat, kind of fusiform shaped body with these really big hind legs that they use to swim. Their anatomy is a little different from other frogs. A lot of frogs have big tongues that they use to grab their food. These guys don't actually have a tongue. They use their little T-Rex front limbs to push food into their mouth, and that's how they eat. Their main use in research is these guys produce large numbers of very large eggs that are really easy to manipulate and use. So they're used in surgical harvest and developmental experiments using the eggs. Rana, the leopard frog, and the bullfrog, these are semi-aquatic. They also have these really big hind limbs, but they're used more for jumping. A lot of these other frog species or amphibian species are used to look at things like endocrine disruptors, environmental toxins. They're also used for pain research, a little bit of physiology. There is some interest in regenerative medicine. Some of these guys can regenerate whole limbs or partial limbs, so there is interest in that. Historically, the major use of amphibians in research was as the very first pregnancy test. So what people would do was they would get a female frog, inject urine from a pregnant woman into the female frog, and then watch for egg production. It would usually take about 12 hours. And if the frog starts producing eggs, that's an indication that the human woman's urine contains human chorionic gonadotropin produced by the fetus, and that's a positive pregnancy test. So I really love this quote I found in some old-timey literature. It says, "Thank you for your report on the pregnancy test of Mrs. X. You may be interested to know that of one GP of many years standing, one specialist gynecologist, and one frog, only the frog was correct." So because this is hormonal-based test, this is highly accurate and highly sensitive. And this was the OG pregnancy test before we got the little sticks. Fun frog facts for you. Some other uses of amphibians in research, they're used a lot for, again, physiology, endocrinology, especially the effect of endocrine disruption on the endocrine system. We look at them a lot for development, reproduction, ovulation. Metamorphosis is an ongoing interest. How does this creature go from basically a aquatic animal to a terrestrial animal? It's pretty fascinating. Involves a lot of apoptosis for those of you studying GenPath right now. There are also several pretty well-established methods for monitoring embryologic or fetal toxins, and that's the FETAX assay, stands for Frog Embryo Teratogenesis Assay in Xenopus. So this is used to look for teratogens that may affect human development. A little bit of unique amphibian anatomy you should be familiar with. There's no diaphragm, so these lower species, we're talking about things like birds, reptiles, amphibians, fish, they don't have a diaphragm, so they have one single body cavity that's called a coelom. They don't have any ribs, so they have these little vestigial processes off their vertebral bodies, but no true ribs. And then they have some kind of unique or fused bones, the radioulna, the tibiofibula, and the urostyle, which is like their kind of like sacrum. And then a little bit of microscopic anatomy. I focus a lot on skin because skin is one of the primary things you're going to be evaluating if you're doing any amphibian pathology. It's extremely important to them. It's a very sensitive organ. It's the largest organ, as you know. And so we spend a lot of our time there evaluating. So I'd really like you guys to be familiar with what normal amphibian skin looks like. They have a lot of mucus glands to keep their skin surface moist. The actual epidermis itself is pretty thin. They do have these granular glands here in this figure. It's called a poison gland, but they don't always contain poison because not all amphibians or frogs are poison. And they're these very often extremely large glands filled with this kind of granular looking material. I don't want you to mistake this for, a dilated sinus or, hemorrhage or anything weird. This is just normal frog glands. And here you can see the mucus glands. And then they have these pigment cells that are called chromatophores, basically our equivalent of melanocytes in the skin. Tadpoles, since tadpoles are essentially fish, they will have a lateral line. This persists in some adults, especially the more aquatic leaning species. And then just so it doesn't trip you up like it did me in my residency when I was looking at a lot of frogs, some amphibian species, especially frogs, will have streaks of mineral running through their dermis. That is a normal finding. Doesn't necessarily mean they're hypercalcemic, but it does depend on the species. That's not present in all species. And then back to a little gross anatomy. Frogs have what's called a drink patch on the ventral abdomen groin area, which is an area that's kind of extra thin. It serves for water absorption. So that's always an area you want to look at and collect when you're looking at frogs submitted for necropsy, is that drink patch, that caudal ventral abdominal skin, and then basically the upper thighs or the groin. And then digestive tract, just one thing that's a little bit unusual. Frogs and amphibians store their fat in these coelomic fat bodies, which look like these kind of like frondy fat fingers. They're sort of cute. I've got a picture of them coming up. And then pigment. Again, these lower species, reptiles, amphibians, fish especially, have a lot of what are called melanomacrophages, which are pigment-containing macrophages, and those can be normal in many organs, including liver, spleen, reproductive tract, some areas of the skin. So don't be alarmed if you see a lot of pigment inside your frog. All right, so this is a fixed specimen. You can tell because he or she is a little bit brown and dry looking, but these circled structures here that look like kind of frondy, fingery, orangey things, those are the fat bodies. So this is a nice, healthy specimen. This is a nice fat frog. These things can get larger or smaller. They can atrophy with things like nutritional disease, starvation. All right, so today in part one, we're going to cover primarily infectious diseases of amphibians, primarily frogs. Here's a quick rundown of what we're going to be going over. If I were a veterinary student looking at this list and worrying about NAVLE, I would be most concerned about Chytridiomycosis, or chytrid, down here under the fungal diseases. All right, so probably one of the most common things that we see in frogs, especially the more aquatic species, but really any species of amphibian, is called red leg. It is what it sounds like. Their legs turn red. The more appropriate pathologic term for this disorder is bacterial dermatosepticemia. So really just kind of breaking down that name, it's a dermal condition that indicates a septic process. So these animals are bacteremic, septicemic, and their skin is a manifestation of that sepsis, often occurring on, again, around that drink patch, the legs, the groin area, because it's very sensitive and thinner skin. Aeromonas hydrophila is the organism that's commonly implicated. However, you see this with really any gram-negative sepsis, including Mycobacteria, which is not a gram-negative, but really any major bacterial sepsis. So there are a lot of things that do that. I think of red leg pretty similar to how I think of petechiation on the ventrum of fish. I see that, and the first thing I see is, oh, this fish is septic. So you should associate it more with septicemia, I think, than with specific pathogens. But Aeromonas hydrophila, for board's purposes, if it's multiple choice, that would probably be the one I chose. Culture is not usually helpful for diagnosing or managing these things, same as in fish. I never really recommend external cultures, skin cultures of really any organism, but even less so something that is swimming in its own filth, right? Nothing aquatic, semi-aquatic. The agent of septicemia is getting in through the skin, so these are often opportunists that are found in the environment. Culture is not going to be helpful for diagnosis or management. Assume it's a gram-negative or some sepsis, and try to deal with the underlying cause of sepsis. Is this animal debilitated? Is there poor sanitation? Do I have stress or overcrowding in my tank? We saw a lot of this with chronic mycobacterial infections. So these animals would be debilitated from chronic myco, or they would have little skin ulcers from myco, and these other environmental pathogens would get in through the skin. So this is often a group of multiple animals. It's often within a tank because of that shared environment. Often all the animals within a tank or multiple animals are experiencing those same stressors that make them susceptible to this. So here's what that looks like in a xenopus. Here are some cases that I had during my residency. And here you can see the ventrum, especially of the frog, this groin area, the drink patch, and then all down the leg, including the toes. It's just covered in these pinpoint to coalescing little red petechiations. Again, it's especially ventral. If you look closely, especially at this dorsal surface and along the toes on the dorsal surface, you can see some erosion to ulceration. There's a little bit of skin sloughing. And then hard to appreciate if you haven't looked at a lot of these guys, but this guy is also swollen. So he's got some generalized tissue edema. He's trending towards anasarca. So he's starting to lose fluid balance. So localized or generalized swelling is also really common with red leg because, again, it's not just a local cutaneous disruption. These animals are septicemic. Mycobacteriosis. This is common in frogs. It's prevalent in the environment. It's important to us, especially because it's a zoonotic pathogen. Mycobacteriosis and fish and frogs and other aquatic species is a cause of fish handler's disease or fish handler's granuloma. It can cause cutaneous lesions in human handlers. This is another one I've seen not uncommonly in laboratory facilities. So the challenge with this is that these guys form biofilms, and they are extremely difficult to remove from a tank or an enclosure. They get in the piping, they get in all the systems. So you have to basically depopulate and do really hardcore decontamination to get rid of these guys. Multiple species, similar to aquatic and reptilian myco. A lot of them are kind of overlapping, same species. Grossly, this can present a lot of different ways. I've seen it present as both cutaneous disease, with nodules, ulcers, especially on the head, the face, the feet, and legs, especially areas of trauma. So Xenopus, they kind of bump into stuff with their little nose. They're not super coordinated. So they'll often get lesions on the face, kind of like this middle picture, little myco ulcer on his face. It can also be visceral. So with or without cutaneous lesions, you can get visceral granulomas. And all of these lesions are going to be loaded with acid-fast bacteria. Amphibians and fish tend to not control their disease very well. So lesions are often multibacillary, lots and lots of acid-fast bacteria. And then these guys also are often usually septicemic. So look for those symptoms of red leg. Look for that cutaneous erythema, anasarca. Impression smears of these lesions, because they are usually so loaded with bacteria, are often extremely rewarding. Here's a couple more cutaneous presentations. You can see is the little dart frog that has some lesions on the feet. Tree frog that has a lesion on the face or the nose. Again, these are the most common areas, these areas that you would expect to be exposed to more abrasions or trauma. And then here are just a couple examples of visceral mycobacteriosis. Frog granulomas can look a little bit different. They are often, I feel like, a lot more wet and a lot less solid than I see in some other non-mammalian species. So down here is the heart, the liver on either side, and then this pink fleshy looking mass below the heart is a giant granuloma. You can see it looks pretty moist. These orange kind of frondy things around and below it are the fat bodies. So this frog was actually in decent nutritional condition. All right, this is probably the #1 most critical disease of frogs for NAVLE, for life, for all boards of any purposes. If you only know one thing from this lecture today, remember Chytridiomycosis. This is a water mold. So it's a waterborne fungus with 2 different forms, kind of similar to Pythium or other oomycetes, if you're familiar with those. There's a trophic form, which means it grows like a fungus, and a motile form, which means it grows like little zoospores. Basically, they swim around. So it's like a half fungus, half protozoan kind of thing, but it is a fungus. It's a water mold. Again, similar to Pythium. This is a major, major pathogen of all amphibians. It's ubiquitous. It's everywhere that amphibians are present. And it is a fatal infection of the skin. Remember that the skin of an amphibian is of critical importance to them. It helps them with osmoregulation, thermoregulation, electrolyte balance. So they are very, very susceptible to disruptions in their skin. And this is a skin infection. Skin infections in frogs are going to be fatal when severe. It only affects keratinized skin, so only adults are susceptible to lethal disease. Tadpoles can be affected, but it will only be the mouth parts, because those are the only parts where they contain keratin. Worldwide, this is a major cause of amphibian decline, especially in the wild. This photo you see here was from a die-off of wild frogs, where they're just collecting hundreds and hundreds of animals that died just so rapidly from this disease. In captivity, this is one that's going to be associated with poor husbandry. It is highly contagious, so it can also come in, with, new species of frog if you're not quarantining new animals that come into your enclosure. But it's also associated with things like temperature, water quality, poor sanitation. Again, animals that are crowded, stressed, or have pre-existing or other skin injuries are going to be more susceptible. Diagnosis is by PCR of skin lesions. You do want to be kind of cautious with that PCR. Usually it's done by a skin swab, but when you're doing that, you can also isolate it from the environment. And again, it can be ubiquitous in some environments. So just a note of caution when sampling by PCR, you can get false positives from the environment. Scrape or wet mounts of the skin lesions can be quite a bit more diagnostic and reliable, because they are, if you see those characteristic thalli in your mounts, you have a positive diagnosis. Histopathology is also characteristic, so often the diagnosis is just through necropsy and histopathology. Clinically, this is a disease that has both high morbidity and high mortality, so sudden death with no lesions in adults, sparing tadpoles, is a common presentation. You can also see just these lesions of septicemia, skin discoloration. Dysectasis is also a pretty common lesion, dys meaning abnormal, and ectasis referring to normal skin shedding that happens in amphibians and reptiles. So their epidermis is proliferating, they're hyperkeratotic, and you see this increased or abnormal skin shedding, usually starting around the digits. Here's another image of what that looks like. Again, sorry, this picture is a little bit out of focus, but the nodules are in focus. I'd really like you to focus on these areas of skin that look a little bit more gray. They don't look quite as brightly frog colored as the areas around them. And those are areas where the skin is thick, hyperkeratotic, and there's increased mucus production here. So that's why the skin looks grayer and thicker. On histo, characteristic findings are hyperplasia of the epidermis with hyperkeratosis, which can be pretty extreme. And then remember, this is an organism that is keratinophilic, so you're going to see it within the keratin layer, intracorneal organisms. The organisms are PAS positive if you need that. However, their appearance is highly characteristic, and there's really nothing like it. So these organisms, these intracorneal organisms, are called thalli. The thalli are these little cysts that you see here, these little circular structures, and they have kind of internal structure. The little dots within the circle are the zoospores, or the zoosporangia containing zoospores. So these are the things that are going to pop and release the more kind of protozoal form that's modal and swims around. You can also see empty thalli, which are these kind of, they're the same size and shape, but they're empty. These big circles, there's an arrow pointing to one right there, but there's a bunch of them. So these are thalli that have ruptured and released their zoospores into the environment, and these are now empty thalli. So all of these are highly characteristic. If you see this, gotta be chytrid. Here's what that would look like in a skin scrape. So this would be just scraping off that hyperkeratosis in that keratin layer. And again, you can see these strips and flakes of keratin, but also these really characteristic thalli. Many of them are empty. They've already discharged, but quite a few of them still have these internal zoosporangia or zoospores. Another thing you can see in this image, there's a lot of superficial bacteria. So all these little purplish, they look like tiny little dots. So this animal is very likely to have a secondary opportunistic skin infection. And then here's just one more close-up image of chytrid in kind of those different life stages. So it goes from this immature thallus, which has kind of this indistinct, blob nucleus-looking thing, to a mature thallus, which has these individualized zoospores. If you catch them at the right time, you can see what's called the discharge tube, which is how they kind of spew their contents out. And then it leaves behind this empty thallus, or this basically empty cyst. All right, other things that cause problems on the skin of amphibians and also fish. Saprolegnia, this is another saprophytic water mold. If you're familiar with this disease in fish, it's pretty much identical. This is an opportunist. It's present in the environment. So this is another one that's going to be associated with poor husbandry, sanitation, water quality, crowding stress, all of those things we talk about with mycobacteriosis, with red leg, even with chytrid. So a very, very common theme in fish and amphibians is these diseases are occurring secondary to poor husbandry. They are often not primary conditions. They're secondary to something wrong in the husbandry or the environment. So that is a major, major concept of aquatic and amphibian medicine and pathology. And then again, because their skin is so important to them, death is usually due to disrupted osmoregulation through that skin surface. This doesn't progress quite as rapidly as chytrid, so presentation is not usually that of a found dead frog. It's usually of a fluffy, furry, moldy looking frog, like this poor gentleman here. On histo, again, it's pretty characteristic. Lots and lots of fungal hyphae within the epidermis. Here again, you can see there are also many superficial bacteria in this keratin coming along for the ride. So mixed infections are extremely common. Again, these are all opportunists in the environment. So they're all just here preying on this frog that's debilitated for some other reason. All right, moving on to viral diseases of amphibians. There's a couple I'd like you guys to know about. Ranavirus is a big one. This is pretty widespread and has a pretty broad host range. So this is one that is not amphibian specific. Even the name Ranavirus, Rana means frog, so it's a bit of a misnomer because it is not specific to frogs, and it likely did not even originate in frogs. We think this came out of fish because fish have a lot of iridoviruses. So this seems closely related to more of a fish origin virus. Susceptibility to this virus is going to vary quite a bit by both species and age. So in all species, young animals are going to be most susceptible. So tadpoles and metamorphs are basically half and half frog and tadpole. So like this guy here who's like got a tail but also legs, that's a metamorph. In the most susceptible population, so tadpoles, metamorphs, young things, it can reach 100% mortality. So this is another one that should be on your list for high mortality events. However, big difference here is Ranavirus is going to target young animals. Chytrid is going to target adult animals. So that's one way to differentiate those two causes of major die-offs. This is one that's highly infectious, so it's transmitted horizontally between animals. It disseminates systemically pretty rapidly. So dissemination and death can occur within 3 days, again, depending on how susceptible you are, up to several weeks in less susceptible species, and also with less virulent forms of the virus. This is a notifiable disease. Again, we're highly worried about our amphibian health and the environment, so this is one that is reportable. Clinical signs, again, there is quite a bit of overlap externally with the presentation of things like chytrid and red leg. Frogs are going to have lethargy, anorexia, just kind of ADR frog. Erratic swimming, buoyancy problems can be more common in these guys because they can have lesions in the brain or the brainstem. But externally, they're going to look very similar to any sick, debilitated frog. They're going to have anasarca, cutaneous lesions secondary to septicemia or ulceration. And then internally is where the presentation is going to be different. So this infection is highly necrotizing. So internally, you're going to look for friable necrosis, hemorrhage, edema, swelling of internal organs, red, darkening. And then on histopathology, you're actually going to see foci necrosis. So kind of similar to like a herpes viral necrosis. It's little foci of necrosis everywhere with occasional basophilic intranuclear inclusions. So again, quite a broad range of presentations depending on things like species, age, virulence of the virus. Both internal and external lesions are common. I would say that the internal lesions are a little bit more characteristic because the external lesions have a lot of overlap with so many of these other opportunistic diseases involving the skin. But if you have a high mortality disease, especially involving the youth in your frog population, you should think about Ranavirus. All right, Lucke's Herpesvirus. I think this is one of my absolute favorite frog facts and frog diseases. So this is a herpes virus. It's an oncogenic herpes virus that causes spontaneous disease, as far as I know, only in leopard frogs or Ranamphibians. Infection, if we think about herpes viruses in general across species, including mammalian herpes viruses, we think of a high prevalence in the affected population. So almost 100% of animals are affected, and infection occurs very early in life. So animals become infected within the egg or once they're tadpoles, and it has a tropism for the renal convoluted tubules of the kidney. The absolutely amazing thing about this viral replication cycle is that it's temperature dependent. So in the warm months, in the summer, where the frog is active, the tumor is growing. You have invasion, metastasis. There are no viral particles detectable. And if you necropsied a frog that had this virus and infection during the summer month, you wouldn't be able to see any viral inclusions because the virus is not replicating while the tumor is replicating. However, once temperatures get cooler in the fall, once they start hibernating, growth of the tumor stops and growth of the virus begins. So the virus is proliferating, it's lysing renal tubules, and you're excreting virus in urine so that you're able to then reinfect eggs and tadpoles that are emerging in the spring. So this is a strategy of the virus. So if you necropsy an animal during the winter months or during the fall, you won't see a lot of mitotic figures as if you would in the summer, but you'll see a lot of viral inclusions because this is the time of active viral replication. So I don't know why you would necessarily want to do this, but experimentally, or if you happen to have a pet leopard frog afflicted with this very specific condition, you can maintain them in colder temps to slow tumor progression. I don't know what that will eventually do to their kidneys because it is a lytic infection. So it would be interesting to see what that does long term. If you do have a pet leopard frog afflicted by this and do perform this experiment, please call me. So this infection is often going to be clinically silent until the tumor grows so large that it's going to start effacing actual renal tissue, or until it metastasizes, causes compromise of an organ, either through metastasis or compression of organs in the coelom. So usually death is due to effects of the tumor, not actually of the lytic cycle of the virus. So grossly look for renal masses. They can be unilateral or bilateral. These can be quite large. As you can see, this one in the bottom picture is basically filling the coelomic cavity. The guts have been reflected upward along with the liver, but it's really kind of pushing everything upward and out of the way. These do metastasize. They'll go to liver, lung, other organs. All right, Pseudocapillaroides xenopi. So this is a cutaneous nematode infection of African clawed frogs specifically. However, there are other Capillaroides species that affect other species of amphibian. So Capillaroides, Pseudocapillaroides infections of the skin in amphibians all basically cut paste from this. Their life cycle is completed entirely in the skin, so this is purely a cutaneous pathogen. However, adults are burrowing, so they will burrow into the skin, and this can predispose them to erosions, ulcers, again, all those other secondary infections that we talked about, saprolegnia, red leg, things like that. So presentation-wise, this will usually present as like a gray thickening or roughening of the skin on the dorsum. It's usually kind of, I like to think of it as the pants. It's like the pants area of the frog. So it can be dry, rough, kind of crusty. They can get erosions or ulcers. A lot of the crusting and the grayness, similar to with chytrid, is from just proliferation of the skin, just from the irritation of the worms being in the skin. So it's hyperkeratotic, it's acanthotic, it's thickened. And then occasionally you can see the little nematodes in the mucus on the overlying skin. They're pretty small. You could definitely see them in a dissecting scope and definitely on histopathology. So here they are as a little nematode burrowed in the skin. They've got these little lateral alae. All right, and then Strongyloides. These are pretty important. I've seen a lot of this in not just lab frogs, but also pet frogs. These are both enteric and systemic infections. Enteric, I think, is a bit more common. They're strongyles, right? So they're large nematodes. They have a direct life cycle. They're primarily enteric, and they cause primarily GI signs. So wasting, prolapse of the cloaca. Here you can see this little guy is a prolapsed cloaca. ventral edema, all the other signs that go along with septicemia, this time from the gut and not the skin. But you can still get those skin manifestations. Gross pathology, you're going to see primarily thickened intestines. Remember that the default form of inflammation in these lower species, birds, reptiles, amphibians, is going to be granulomatous rather than suppurative or even eosinophilic. So you're going to see granulomatous enteritis, and then hyperplasia of the intestinal mucosal epithelium. So first picture, top left, here's another more severe cloacal prolapse. Top right, you're looking at the intestinal tract and all these little white dots, these raised white foci that extend, it looks like transmurally through the wall, are all little granulomatous lesions containing nematodes. And then down here, less commonly, these guys can also do cutaneous migration. So you can get little skin lesions, little small ulcers associated with these as well. All right, so that concludes part 1 of amphibian diseases, all the infectious diseases and anatomy. If you have any questions, I would love to hear them. Please leave them in the comment section or come join us on the Discord channel. I'd love to have a discussion of frog pathology with anyone who will engage with me. Next time, I hope you'll join us. We're going to talk about non-infectious diseases of amphibians on part 2. Thank you. Take care of yourself.